Hi, my name is Jillian from Troy, Michigan. I will be introducing and summarizing our debate today involving in-home ABA therapy compared to Tele ABA. Applied behavior analysis therapy has been occurring with children with autism, mainly in person for many years, and has proven to be a very strong evidence-based treatment. According to Centers for Disease Control and Prevention, 1 in 88 children under the age of 18 have autism spectrum disorder, and many of the children are provided ABA services or are in hopes of obtaining the therapy. However, when conducting a search through the BACB website of certificants or BCBAs in the state, many are practicing within highly populated areas and cities, and lack of access of service providers can occur for children in rural areas or states with low number of BCBAs. Telehealth services is a new service that works to provide ABA consultation for individuals who have low access to community-based, person-centered services. Today, Marcia will be presenting and discussing her proposals and benefits of Tele ABA, while Maggie will be filling us in about current benefits of in-home ABA. Emily will also be participating in our debate today as the fielder. To summarize Tele ABA is instruction and meetings of ABA tactics involving communication training, a functional behavior analysis assessment with feedback, a behavior plan intervention, and involvement of appropriate reinforcement schedules involving behavior increase or reduction. Tele ABA is conducted completely online via in-home telehealth. It is conducted mainly between parents or teachers of a child with autism spectrum disorder and with a trained professional of behavior intervention, or a BCBA. Tele ABA is used to support long-distance clinical health care, patient and professional health-related education for those who do not have direct access to care resulting from their area of living.
Marcia, what are some pros of Tele ABA?
It has been shown through research that Tele ABA is great at providing functional communication at a lower cost to individuals with autism spectrum disorder. It allows for family members to be and learn the process of ABA and how to implement the procedures through education and training in the comfort of their own home. This form of service delivery, when strategically implemented, has the potential to enhance the quality of services available to parents and caregivers who may be located geographically remote areas and having schedule conflicts or require additional material and resources. This also allows for family members to do functional analysis with the support of a BCBA and are given access to the BCBA if they have any questions or concerns at any time throughout the day. The research has shown that Tele ABA has had the same results as if the individual with autism spectrum disorder would get if they had one-on-one therapy. Every child shown at least a 68% reduction in target problem behavior, and the majority show a reduction of over 90%. These results strongly suggest that the use of telehealth services as part of early intervention programs for children with autism who display challenging behaviors can work. The treatment package of FA plus FCT can be conducted via telehealth by training behavioral analysis with minimal training of parents, and this appears to be highly efficient and effective treatment. Whether delivered in vivo or via telehealth, the cost is much less and the convenience for family has been made clear.
Maggie, based on research, what have you found for cons of Tele ABA?
Well, the research that I have tried to find is pretty slim when it comes to Tele ABA. So it's hard to find a lot of data to support the effects of Tele ABA. Tele ABA at times can be often like a he said, she said scenario where most of the information is relied on indirect assessments rather than direct assessments.
Now for our summary of in-home ABA. In-home ABA is when a qualified professional physically goes into an individual's home to provide ABA services. ABA therapy consists of an FBA or an FA assessment, consultation and training with the family, a treatment plan written by the BCBA, ABA therapists providing the therapy, weekly visits, and one-on-one working with goals within the home.
Maggie, can you tell us about research-based pros of home-based ABA?
I sure can. So, in-home ABA therapy is well known and it's used with many clients. In-home therapy provides therapists to work in the comfort of the child's home and provide natural environment teaching strategies and the ability to communicate and work with the families as well. So this area of ABA has considerably more research and data to support the effects, and just being physically present with the clients, the child client and the parents, provides therapists the opportunity to truly grasp and understand the environment. And there's also a stronger communication learning opportunity for the parents.
Marcia, what is your response?
The downside to in-home ABA is a lack of social interaction with peers of the individual's age and developmental level. This also does not allow for individuals to generalize their skills in the environment that they are not familiar with or that may cause problem behavior such as school or community settings if the in-home setting is all the individual is receiving ABA services. There's also challenges with therapists at times. They may have an issue because of the different clients and trying to make sure that each individual has the time they need. There are also maybe problems with the therapist being present in the home because siblings having to stay out of the way when the child is getting the therapy, and this can give less attention to the siblings. This may also cause issues for the other children in the home who feel they're being left out or excluded, which can also change the family dynamics when they are feeling like they are not getting as much attention as the child who has autism. The price can also cause a financial difficulty because in some cases the families may have to pay out of pocket for their services and the cost may be too high, but they have no other way to get the ABA services in the area that they live.
Now we will have Emily fielding questions regarding the comparisons involving Tele ABA and in-home ABA.
What are some of the negative aspects of Tele ABA?
Finding the information and cost for Tele ABA is not easy to find at all. This is probably because there is not much data or research to support Tele ABA. Research from an article by Wacker suggests that providing treatment through telehealth should not necessarily replace intensive programs for children with autism. So with Tele ABA, there's also no contact with peers or community members, so it's pretty hard to generalize what is implemented in the home with just the parent.
What do you think of specialists using the webcam to observe behavior?
I think overall it's a good idea. However, the webcam only shows so much, so you can only see the view of the camera, whereas in person you're able to get the full experience of the entire environment. And some of those experiences are just the full visual of the environment, the smells, the noises, the facial expressions of the parents, and there's many more. All of these things are important in understanding the environment and possible antecedents for certain behaviors.
This also why the parenting with using the webcam, the parent and caregiver are getting training to help perform the functional analysis, and they can also do a video anytime they feel necessary to send to a BCBA that gives them access to look at over and over again. That can be a pro to having Tele ABA, and it also gives them the opportunity to, in any environment, record it and send it to a professional to look at when they feel like they need help on a specific behavior. So it also can be a pro to using the webcam.
Do you think the expertise from the BCBA is any different compared to in-home ABA?
From a study by Boivert, the time and expertise needed to provide training to the parents and caregivers may be limited with Tele ABA. The input may be a little more limited time-wise than a BCBA that is physically present. It's also much easier to converse in person in the specific environment rather than through a webcam. So the BCBA is most likely to have a better understanding and input if they were able to meet the child, the family, and experience the behaviors firsthand.
There also have been studies that show that tele-ABA, that the parents actually have more access to a BCBA because at times the person going in the home is not a BCBA but is supervised by a BCBA. So in some cases, there's not always a BCBA available in the in-home where through telehealth they make sure to have the BCBA doing the services.
What are some ways that in-home ABA benefits the parents?
The parents are benefited by in-home ABA therapy because they are able to see the therapist model teaching procedures and behavior protocols. So once the therapist models these procedures, the parents are then able to implement these protocols and get appropriate feedback from the therapist. So when there's a therapist that is physically present, it can make the learning process for parents much easier. It also provides more support in home and the natural environment for the child and for the parent. And in a study by McPhilmy, surveys from parents showed that the relationship between the parent and child became stronger when there was a therapist that was able to kind of help be the buffer. It provided a healthier environment of acceptance while also teaching healthy boundaries between the parent and the child. So the therapist helps facilitate the parent's interactions with the child to provide more positive reinforcement.
This is can also be seen through using the tele ABA system because how involved the family members have to be to learn the procedures, to learn what they need to know to do in order to implement, because they're the only ones hands-on doing the ABA therapy through the training they got from the BCBA through telehealth. They're also at their house and in the same natural environment as they would be in home. It's just the parents are doing it instead of an ABA professional.
Are there any benefits for the siblings in regards to in-home ABA?
Well, according to a study by McPhilmy, the in-home ABA can provide a lot of positive effects for the siblings. Many times the therapist helps facilitate a positive social interaction between the siblings.
In-home does have a positive effect in most cases, but in others there can be downsides, and studies have shown that siblings can still feel left out or excluded because the therapy isn't specifically for them, and so you have to be careful to still be giving attention to the child with autism spectrum disorder as well as the children who do not have the disorder. And it also just doesn't allow for the children to interact with peers of the same age or of different developmental levels, depending on how old the siblings are. So you could also run into that issue because if they are way younger or older than the child, the interaction may be completely different. So doing in-home or even tele-ABA, you're left out of the interaction that helps the child develop in a way that's going to help them socially, which is one of the biggest issues that most children who have autism spectrum disorder need help developing in.
There are behavior benefits for children with autism seen in both in-home ABA therapies as well as tele ABA. In-home ABA can be seen to create a great deal of quick progress. However, it is not provided for a family in a rural area for direct access. It may also prolong treatment for individual if they cannot receive direct one-on-one in-home therapy. We conclude that if a family lives in a rural area and cannot receive behavioral services directly, Tele ABA might be right for them. If a family is able to provide in-home ABA services and consultation, we suggest that this is best as well. The decision comes down to the family's needs and wants behaviorally and financially. Thank you for watching, and thank you to all the participants.